kids are just changing on a daily basis. The phrases they use, it's hard for me to keep up. I've also had to really adjust my philosophies a lot. When I started in psychiatry, gender neutrality wasn't a thing or hadn't become common. So even in terms of my language, I've had to learn to refer to children as they, them. And that was difficult for me, especially with English being my second language. It's been difficult to make that adjustment. And over again, I have learned to be non-judgmental, be non-judgmental, be non-judgmental. And it's been quite a growth for me. I learn more from my patients than from anybody else.
When you look at mental health issues in kids and really even in adults, they are on the rise. Do you think that's because of the way we live, or do you think we're just more sensitive to screening?
I think mental health issues have been long-standing. And I'm not sure if mental health issues are on the rise or just the diagnoses are on the rise. It's hard for me to tell. Kids are on social media now and self-diagnosing. And, you know, it used to be that people would come to me and say, I'm not feeling right. What is going on with me? Now they come in and say, I have borderline personality disorder and I have PTSD and I have ADHD. And I say, okay, let's let's say hello first. It is, I think there's a lot going on with social media that's affecting how we look at mental health. And the positive side of that is that we have become that mental health is much less stigmatized. My concern at this point is that to some degree, it's become kind of cool to have a couple of mental health diagnoses amongst at least a subset of children. And that's concerning to me.
In your experience in a youth center where you used to practice a lot, you're telling me that over the course of the last, I don't know, 10 to 15 years, you've seen a rise in children coming to you saying, I have anxiety, I have depression, I have.
Yes. Oddly enough, it's not anxiety and depression.
What is it?
Anxiety and depression are not cool enough. It's something else. PTSD, personality disorders seem to be a lot. I have kids tell me they have autism. A lot of children tell me they want to be tested for autism. It's interesting.
Out of those kids that you do see that say, I have autism, how many of those kids are correct? What percentage would you say? Just ballpark. I know just ballpark. What do you think?
I think a good portion. Maybe more than 50%.
More than 50%?
Yes.
Are self-diagnosing and they're accurate in their diagnosis.
They're accurate in their diagnosis.